So for the laparotomy, particularly if the foreign body present in the intestine, so we give the incision just from the umbilicus or slightly cranial to the umbilicus up to the this much distance. So we can remove this fat, although for the when we remove the fat, so there is a bleeding, as you could see in this particular case. So this one is the linea alba here, so better to apply the hair and the artery forceps. So this one is the with the reverse blade we just pierce this one. So in this way we have entered into the abdominal cavity. So this mild oozing of blood will stop automatically after few minutes, particularly when you apply this artery forceps. So this one is the spleen visible, and I could feel here the foreign body which is see. So this is the big stone. This is the reason why it is not able to move. You could see here, so there is a slight inflammation of the serosa, and here is the serosal tearing as well. So better to keep this all intestine into the abdominal cavity. So this one is the posterior part and this one is the anterior part, from where this foreign body progresses from anterior to the posterior. So you could see, so this is slightly compromised. This one is the okay. So next step is simply we we put like this, we separate this one, and then we make an incision here, and better to keep the another drape just underneath this part of the intestine. So whenever the foreign body is present, so we should not incise just over this obstructed mass or over the foreign body, because this is the inflamed serosa. So we always give the incision just over the healthy area or in this one like this. So we strike like this. So better to give the incision here like this in the healthy area. And then we extend like this. So better to grasp like this. So this is the stone. So this is the stone. So we keep one side. And now once we remove the stone, so what happened? So there may be chance that anterior part which slightly here compressed. Apply the intestinal forceps, that is the intestinal joints forceps. And then next step is simple closure of this part. This is the enterotomy. So we repair this one in the simple continuous or in the simple interrupted, you can, but since it is the intestine, so sometime a surgeon, you can say, go for the double layer, but if you perform meticulously in the single layer, so that is sufficient. So here we take the bite through and through. This is the 40 polygalactic 910 observer suture material. So here we take the bite like this, you just see carefully. So this is the serosa, this is the full thickness, and again this is the emerging from the serosa. So if you, and the distance should not be more than 2 to 3 mm. Slides oozing from the subserosal, creating problem. So here you could see the bite we should take carefully, involving the OR layer, because here strength in the intestine is the submucosa. So we repair from here to here in the simple continuous pattern, and this is the volley up. Now we are almost approaching towards the closure. So there are several suture pattern you will find in the textbook. Gambi pattern, Ischemedian pattern, but this one is the simple continuous pattern, is the very good, and it is the very easy to perform also. But with this you have to select the suture side very accurately, appropriately. This is the 40. If you want to repair with the number 10 or 20, so definitely it become the thicker, and there will be inflammation, and there will be problem in the healing as well. So selection of the suture site is very, very important in all surgery, particularly in the repair of the intestine and the stomach. So once we perform here, then we can go for the leak test, and then after that we go for the Omentalization. So in this way we have closed the enterotomy incision. Oh, this is the So in this way we repair this intestine. So we remove this glands clamp, and if you see here, so if you push here like this, so there is no leakage. And this is a very beautifully repaired intestine. And this slight tear which happened during the sterilization because of this too much inflamed, so it will heal automatically, and we just go for the omentalization over here also. So now the next step is wash this one, then I will change these gloves and then perform the omentalization and then repair for this laparotomy incision. As per the location of the foreign body, we suspected that it is in the jejunum, but it is not in the jejunum, it is basically in the ascending duodenum. So it is in the duodenum, and then from duodenum it is started, basically this is jejunum. So because this one is the fixed with the duodenocolic ligament, this one here, so this is the duodenum. So now we apply this, we go for the omentalization here, we wrap this area also, and then like this here. So this is called the omentalization. So one part we fix with the serosal surface of the intestine, and then here we fix with the mesentery. So this omentalization is acts as a physiological drainage, and it will prevent any infection, or it will restrict the animal, also increase the blood supply. It is a natural phenomena to restrict any infection, spread of any infection, as you might have been noticed during the extravasation or during some foreign body which is present in the intestine. So during laparotomy, when we extravase, so omentum is already wrapped around that. So that is a natural phenomena. So since here this one is the duodenum, so we fix here, and then now you could see this is the repaired part. So we covered this repaired part completely, and just okay, it's okay. So now we just put into the abdominal cavity here. So now this one is slightly looking not good, this blood. Whenever if we cut the fat or the subcutaneous tissue, so sometimes the bleeding seen. So now the next step is just closure of the laparotomy incision, nothing special. I have already shown this closure of the laparotomy incision in the so many videos, so nothing is special. And if you want to become the member of my channel, so you can become the member just by clicking the join button, and you become the member of my channel, so that you can enjoy those videos which are exclusively for the members only. So the benefit of becoming the member is that you can connect directly with me, you can on social media, you can talk on the WhatsApp. So we have closed this abdomen in the simple continuous pattern. Now this is the second layer is going on here. So whenever we take the bite, so we always take the bite in the previously repaired laparotomy or previously repaired muscles to avoid the dead space. Still there is a oozing out there. So now the next one is the subcuticular pattern and then skin. So this is how you can go for the subcuticular pattern. So advantage of this subcuticular suture to obliterate the dead space, to bring the wound in close proximity, and also avoid the tension over the skin suture when we apply. So this is the how, this is the almost, so this is the Aberdeen knot. So in this way we have closed this laparotomy incision. Now the next step is just to put the simple interrupted or the, but nowadays I prefer the horizontal matters and then in between the simple interrupted. So now you could see we have repaired this skin. So I have used the combination of the horizontal matters and in between the simple interrupted suture pattern. So this is how we have performed the enterotomy. We remove the stone and then we pair the enterotomy incision, then perform the Omentalization and then close this laparotomy incision. So thank you very much for watching this video, and if you want to become the member, so kindly click the join button and become the member. Thank you very much.